Good day, ma'am. I am Moreno from Group 3. So today I'm going to present our mind map presentation about antiprotozoal drugs, which is under the antimicrobial agents. So as you can see in our mind map, it focuses on one concept, which is the antiprotozoal drugs, and scattered all the branches, which is the miscellaneous antiprotozoals and anti-malarial drugs. So let's start. So first, what is protozoa? Protozoa is a single cell and a free living matter and categorized by eukaryotes. So they have a true nucleus in the cell. They are more animal-like, and they are parasites that lives in animals and humans. So protozoa is a health issue worldwide in human beings, such as amoebiasis, malaria, and trichomoniasis. So first, what is antiprotozoal drugs? Antiprotozoal drugs simply treats these are drugs used to treat protozoal agents. So what they do is they interfere or inhibit DNA and RNA synthesis. They interfere protozoal metabolism. They interfere ATP synthesis and hinder protein synthesis. So under that, antiprotozoal drugs are classified into two groups, which is the miscellaneous antiprotozoal and the anti-malarial drugs. So first, now go on for the miscellaneous antiprotozoals. So miscellaneous antiprotozoals or miscellaneous antibiotics are antibiotics which are only agent available in their class. This means that they are unique on their action and not comparable to other antibiotics. So commonly we have metronidazole and tinidazole as well as the nifurtide. So metronidazole is the most common treatment for trichomoniasis and giardiasis. Its action is the treatment of protozoal infections remains poorly understood. However, it may work by damaging protozoal DNA. So metronidazole, the generic name of Flagyl, it is an antibiotic used to fight bacterial and protozoal infections of vagina, GI, liver, skin, brain, heart, and respiratory tract. So it was treat a wide variety of infection, works by stopping growth of certain bacteria and parasites. So this antibiotic treats only certain bacterial and parasitic infections. So it will not work for viral infections such as common cold, flu. So for the mechanism of action, it inhibits the nucleic acid by disrupting the DNA of microbial cells. So this function only occurs when metronidazole is partially reduced, and because this reduction usually happens only in anaerobic bacteria and protozoans. So reduced metronidazole causes DNA strand breaks, thereby inhibiting DNA synthesis and bacterial cell growth. So under that, we have also the tinidazole. They also taken orally to prevent stomach upset. Take this medication with food. So tinidazole, same as the metronidazole, antibiotic that is used to treat certain types of vaginal infections, bacterial vaginosis and trichomoniasis. So it also works by stopping the growth of certain bacteria and parasites. So metronidazole and tinidazole are having the same effect on treating the patient. So side effects of this is nausea and vomiting, unpleasant metallic taste, fluid tongue, or mucositis, and anorexia. So first, as stated here, avoid drinking alcohol beverages. So do not drink alcohol or consume foods or medicine that contain propylene glycol while you are taking this medication for at least 1 day or up to 3 days of stop taking it. You may feel any unpleasant side effects such as fast heartbeats, warm or redness under your skin. So next is a precaution with the patients with blood disorder, central nervous system disease, and severe hepatic impairment, and should not be given to pregnant women. So for blood disorder, blood cell disorders such as anemia or lack of RBC or low WBC, anemia of chronic disease, people with chronic disease or other chronic diseases tend to develop anemia. Anemia of chronic disease does not usually require treatment. And next is for the central nervous system. There have been reports of abnormalities in patients when treated by metronidazole. So it should stop taking metronidazole if you feel any neurological symptoms such as seizures, headache, numbness, or tingling. So, severe hepatic impairment, metronidazole can cause life-threatening liver problems in people with cocaine syndrome or a genetic disorder, signs of liver failure such as nausea, stomach pain, or jaundice. And also, this medication may cause your urine to turn darker in color, and should not be given to pregnant women because this medication should be only used when clearly needed, and it may also pass in the breast milk. Next, we now have for the Nifuratil. Nifuratil, on the other hand, is a broad spectrum antimicrobials agent against protozoan or trichomonal vaginitis. So, Nifuratil is a drug used for gynecology. It is a local antiprotozoal and antifungal agent that may also be given orally. So, side effects is GI disturbances, damage to peripheral nervous system, and easy or excessive bruising and bleeding. So, tinidazole works as well as the metronidazole and has many of the same side effects, but it can be given in a single dose. Whereas the Nifuratil can be used as an alternative to metronidazole or tinidazole in the treatment of trichomoniasis. So after that, we now move on to anti-malarial drugs. So anti-malarial drugs simply or anti-malarials are type of antiparasitic chemical agent often naturally derived that can be used to treat and prevent malaria. So example of these are the doxycycline, proguanil with atovaquone, chloroquine, and nafloquine. So for prevention of malaria, the choice of drugs is based on the destination you are going to visit, and the risk is as determined by your traveling behavior and your previous health status. For treatment of malaria, the type of malarial drug and length of treatment will depend on type of malaria you have and the severity of your symptoms where you caught malaria and whether you have taken an anti-malaria to prevent malaria. So first, now have for the doxycycline. What is doxycycline? Doxycycline is a tetracycline antibiotic that fights bacteria in the body. Usually, it treats many different bacterial infections such as acne, UTI, intestinal infections, respiratory infections, as well as gonorrhea, chlamydia, and syphilis and periodontitis. So, this medication is taken by mouth when using to prevent malaria. This medication is usually taken once daily. So, doxycycline may be given injection if they are unable to take medicine by mouth. So, common side effects are nausea and vomiting, diarrhea, difficulty in swallowing, esophageal irritation. So, as stated here, should not be given on pregnant women or patients with kidney and liver disease. So, taking this medicine during pregnancy may affect the tooth and bone development in the unborn baby. Taking doxycycline during the last half pregnancy can cause permanent tooth discoloration later in the baby's life. So, children, and for those patients who have kidney and liver disease, doxycycline is semi-synthetic tetracycline related with bacteriostatic antibiotic that has been linked to rare instances of acute cholestatic liver injury. So, however, instances of severe and prolonged cholestatic liver injury have been reported with oral taking of doxycycline. So, high dose of intravenous doxycycline can cause acute fatty liver typical of that caused by intravenous tetracycline, particularly in susceptible patients such as pregnant women. So, for the kidney disease, doxycycline has been considered a safe, broad-spectrum antibiotic for patients with renal failure. However, doxycycline possesses many of the metabolic properties of the tetracycline group. And next is, should be swallowed whole with plenty of fluid and taken with food. Doxycycline must be taken with full glass of water and drink plenty of liquids while you are taking this medicine, because most of brands of doxycycline may be make sure stomach upsets. So next is to avoid taking with antacids, milk, calcium or magnesium salt. So antacids containing magnesium, aluminum or calcium, and calcium supplements containing iron and magnesium makes the effect of doxycycline less effective. And last is to avoid prolonged sunlight and use appropriate sunscreen. So you need to limit your time under the sun because doxycycline can make you sunburn more easily. So you need to wear protective clothing and use a sunscreen which is SPF 30 and higher. Next is we now go to proguanil with atovaquone. So this medication contains two medicines, the atovaquone and proguanil. It is used to prevent and treat malaria caused by mosquito bites in countries where malaria is common. So atovaquone and proguanil belongs to a class of drugs known as antimalarials. So must be taken by mouth with food or milky drink that contains fat. So you need to swallow the tablet full because the taste of it is bitter, and if you have a trouble of swallowing tablets, this medication may be crushed and mixed with the condensed milk and then take entire mixture right away. So to treat malaria, usually this medication used once daily for 3 days. And for the side effects, it has nausea, vomiting, abdominal pain, diarrhea, cough, headache, dizziness, depression, and anorexia. And it should not be given to pregnant or breastfeeding women. During pregnancy, this medication should be used only when clearly as needed. Because when the pregnant women and infant are more higher risk for death and other problems. So proguanil in this medication passes in the breast milk, and the effects of medication on nursing infant are still unknown. So states here that it is not recommended for patients with severe kidney problems. So for dialysis and renal insufficiency patients, now it becomes increasingly easier to travel to these countries thanks to the recent advances in renal replacement therapy. Now move on to the mefloquine. So mefloquine, as you can see, this medication is used to treat and prevent malaria. Take this medication by mouth as directed by the doctor and take it with food or milk to prevent stomach upset. So do not take this medication with an empty stomach. When using this medication to prevent malaria, it was usually taken once a week. So stated here, it is used with caution with patients with epilepsy, seizures, depression, or other mental health problems, severe heart or liver problems. Mefloquine may cause serious mental health problems, although historically the long-term use of mefloquine for malaria chemoprophylaxis has been considered safe and well tolerated carefully when prescribing is needed to minimize the potential for severe neurological adverse events, including seizure or which individuals with certain neurological histories. For a heart or liver problem, mefloquine has rarely been linked to clinically apparent acute liver injury, and instances of acute hepatocellular injury as well as the cholestatic hepatitis have been linked to use of mefloquine medicine. So side effects of these are nausea, vomiting, dyspepsia, abdominal pain, as well as diarrhea, dizziness, headache, and insomnia, and vivid dreams. So last is for the chloroquine. Chloroquine, as you can see, chloroquine is used to prevent treat malaria caused by mosquito bites. So chloroquine is also used to treat infection caused by different types of parasites, and they belong to the class of antimalarials. So by taking this medication by mouth, orally, so usually to prevent stomach upset, it must be taken with full glass of water, or you can mix it with foods. So, as stated here, use with caution patients with neurological disorders, muscle fatigue, and weaknesses that are under the myasthenia gravis and the G6PD, or the glucose 6 phosphate dehydrogenase deficiency, and liver and renal problems. Neurological disorders, other chloroquine intoxication has been associated with certain extrapyramidal-like movement disorders, including stereotypical repetitive movements, ataxia, facial dystonia, and other neurological effects, including tinnitus and accommodative dysfunction. For myasthenia gravis, chloroquine induced a myasthenic syndrome in a patient taking the drug for presumable reticular erythematous mucinosis. So for the G6PD, or the glucose 6 phosphate dehydrogenase deficiency, given dose recommended for malaria chemoprophylaxis, hemolysis does not appear to be a problem. And for the liver and renal problems, in severe renal impairment, dose reduction of prophylaxis is required. Mostly chloroquine, commonly utilized drugs in prophylaxis against malaria. So, side effects of these are GI disturbances, headache, hypotension, convulsions, visual disturbances, and rashes and pruritus. So, that's end presentation. Thank you for listening.